Good morning. Today I'm doing Happy Toe Tuesdays and I want to talk about fungal nails and feet today. I had questions about fungal nails last week, and fungal nails are very closely related to fungal feet. So that's why if you have athlete's foot, you have to take care of it well because it can easily spread to the nails. And when it's in the nails, it's very, very difficult to treat. So the problem really arises when you share products, like you go to a nail parlor that doesn't clean their instruments in between patients, or they share their utensils, or if you visit gyms or you live in a hostel where you share bathrooms, or you got so that's a big problem. So preferably when you do use the bathroom, you have to make sure that you can use separate shoes that you walk on the bare floor with, and that you make sure that you sterilize or clean your feet well and dry them well, because wet feet wearing the same shoes every day is a high risk for getting athlete's foot and then having it spread to your nail. So athlete's foot, usually your feet itch a lot, especially in between the toes. Little bubbles or blisters can form where you have to, it's very itchy. Once it becomes chronic, and the acute stage is done, it's not itchy anymore, but you can literally have it peel off in layers and layers. Yes, so with nails, what you'll often find when it's just starting, you would see that the nail would maybe start to lift from the nail bed, and it doesn't look happy. And then when it's progressed more, what you will find is that the nail becomes thickened and it looks moth-eaten, and it's very difficult to get rid of once it's established itself. Sometimes you already have the condition 6 months before it actually starts showing in your nails. And there is medication that you can take you get from your doctor, like Lamisol, or topical things that you can put on, like Fix for Nails or tea tree oil. And the basic principle is it's going to take 6 to 12 months for the nail to grow out healthy. So the best thing is to get rid of as much of the nail as you can before you start treatment, because you don't want diseased nail. What you can have done is to have the nail removed and then start treating the nail bed, and then let the nail grow out and hoping that it won't come back. So that's the treatment for fungal nails. Now there's things that I've seen work well, is like to dip your feet into water with vinegar and bleach, and it sterilizes your feet. But you must remember, if there's bleach in it, everything's going to be white. If you don't want it white, make sure that you use it in an area where you want everything to be white, especially your towels that you use. So the mix is 1 liter of water with a tablespoon of vinegar and a tablespoon of bleach. And you can make it in a 5 liter bottle. And especially if you live in a house where you share facilities with other family members, everybody showers in the same shower, to make sure that you spray it on the floor before you enter and when you leave, to make sure that you don't contaminate each other. And otherwise you just manage it, make it look good, and wear it as is, because it takes a long time to manage it. What I also suggest is that you take all your footwear and put it in the freezer for 72 hours, socks, shoes, everything, because that helps to sterilize your things that touch your feet. Otherwise you can reinfect yourself. And another option is to put it outside for 8 hours in the sun. So yes, it's a challenge, and a lot of people struggle with athlete's foot because they only have one pair of shoes that they wear every single day. So it's important to make sure that you air your feet and air your shoes so that they get a chance to dry out, because fungi, as you know, likes dark, warm, moist places. So if you have any questions, you can leave them for me. And you can also check out my food and healthcare YouTube channel. And I have an Instagram account, Foot Care Feet First, where you can see some of the information I post. And of course I have Feet First, which is my Facebook page. So have a wonderful day. My name is Martie Hopflish. I'm a nurse and I do foot care.